Dear ladies and gentlemen, my name is David Lücht. I'm a medical student and currently work as a scientific assistant at the Presbyopia eye surgery in Düsseldorf. Today I may present you our first results on a Presbyopia Excimer laser correction while using high and negative spherical aberrations in a blended vision model, which we call PresbyEDOF. To give you some background to this topic, what is the status quo? Currently, there are two laser systems available on the market to achieve a depth of focus in the cornea. First, there's the Aberrations laser by Schwind, which is not only the fastest excimer laser in the world with 1050 Hz, but it also has a unique 7D eye tracker system to rule out inaccuracies. And secondly, there is the MAL90 excimer laser by Zeiss Meditech, with which we have 10 years of experience using positive spherical aberrations of up to 1.5 diopters and an anisometropia of negative 1.5 diopters to achieve a full depth of vision. In our approach, we thought of using the best of both worlds, trying the PresbyMax Schwind laser with a higher anisometropia. Currently, Schwind only offers up to 1.25 diopters, which we think is not enough for a complete spectacle independence. That is why we tried a new approach by using the PresbyMax laser with an anisometropia of 1.5 diopters and an extended depth of focus effect of 1.5 diopters using negative spherical aberrations. Postoperatively, we evaluated our results, and however we were still a little confused due to the unsatisfying data after 1 month, because patients were still experiencing changes in visual quality. That is why we focused on our results 3 months post-op, and even though we don't have that many patients yet, we still wanted to give you our current data and keep you up to date with the results. Down below you see the pre-op data of the patients, having a sphere of minus 1.25 up to 3 diopters and a cylinder between minus 2.5 and minus 0.25. Important notice is that all of the following data preoperatively are corrected, while the post-op data were acquired without the use of any visual aid. As you can see, 85% of the patients were able to read newspaper without the aid of glasses, and more than 90% didn't need any when working up close, for example, while cooking or using tools. Also, intermediate and distance vision was evaluated and showed very satisfying results, with 90% having a good intermediate and 100% having none or only few problems for distance vision. Evaluation of vision under mesopic conditions also showed an improvement explicitly, which are quite promising results evaluating this in the winter time. Only one patient admitted difficulties when going out to the movies or sports events, while the number of patients driving still remained the same. In general, driving at night had improved, while the fear of bothering relatives or friends due to the impaired vision could also be reduced. Also, small print reading was improved clearly, and when asking patients whether they had problems reading small print, for example on receipts, only one claimed severe problems. Our French colleagues would say "on y soit qui mal y pense," or "a shame upon him who thinks evil of it." He actually still paid his bill. Closing up, our patients had less difficulties in front of the mirror, for example when styling or applying makeup, which resumes for us that our patients actually look a lot better after surgery and maybe feel a little younger again. Even driving under difficult conditions could be improved, even though we have to admit that we didn't check for the outcome of those trips. Last but not least, but probably the most important question, showed that the general quality of life as well as independence of our patients could be improved. To sum up, 100% of the patients we treated using this method would actually do it again and would recommend it to a friend. Giving you an outlook, we showed that this method, which is actually safer than wearing contacts, improved the quality of life for every single patient. And my boss, Dr. Breyer himself, is actually one of them. We hope to give you further and we assure statistically significant data for the next ESCRS, which we will hopefully experience in person again. Thank you very much for your attention, and I'm happy to take your questions.